Hi, this is Losole. You heard me speak about Amy Ingersoll, the obesity medicine specialist that helped me get started on this journey to losing weight and getting more fit. In some cases, eating less and moving more is just too simplistic, or it works for a while and it doesn't. We're unable to sustain it. Amy talks about the differences in physiology and even how the brain and the physiology work together to defeat our weight loss. And she talks about many other types of approaches and ways to help people on an individual basis. And so I hope you enjoyed the discussion we had. Hi, I'm Losole. I'm here where it all began for me 17 months ago and now 70 pounds ago. I'm in Amy Ingersoll's office. She's an obesity medicine specialist, and I talk about her a lot, but it's great. Today you get to meet her in person. So I'm just kind of waiting for her to come in. Come on in. Hey, Amy, good to see you. Great to see you.
You're looking good.
Oh, thanks.
Slim and trim.
Well,
and healthy.
And whoever knew that could happen at the time, but you probably did.
I'm proud of you.
Excuse me a minute. I mean, this is emotional for me because when I came in 17 months ago, I was very robust, and I really didn't think anything could work. I'd done all these diets. I'd done everything, supplements. I thought I was going to have to get lower back surgery, and I came here, thinking the one thing we haven't tried is science. What's the science behind this? There must be some reasons. And so Amy saw me 17 months ago, and maybe you could talk a little bit about that and how you approach this.
Yeah, definitely. It's always interesting, Nick, because this is such a complex chronic health condition that has a lot of bias, stigma, and misconception in medical community and in the general population. So I've been practicing medicine for about 10 years, and I want to make people better. And I kept trying to find a certain disease state that I really made an impact, and obesity was that. And so when you saw me, like you said, there's all this misconception that for patients who are affected by this chronic health condition, all they have to do is eat less, move more. But it's not that easy. There's all these moving parts to it. The analogy I use with you is that the four-legged stool, right? So I talk about in obesity medicine that you have these 4 pillars of care. You have the medical aspect, and then you have the lifestyle, the behavioral, the movement, and the nutrition. And whenever I talk to my patients, and you included, as I tell them, listen, if you are affected by obesity, this chronic health disease, you trying to do it on your own is like being a 3-legged stool. So you have the nutrition, the lifestyle, the behavioral components, but at some point you're going to fall over again. And I have the medical aspect. I'm a 1-legged stool. I'm always going to fall over. But when we work together, the magic happens, right? Mm-hmm. And the reason behind that is I love analogies because I think it helps people to understand it. And the problem is this, for those people who are affected by the chronic health condition of obesity, whether we like it or not, their brain is working really hard to keep them at the weight they're at. Mm. When they start to lose weight, and they're doing everything that everyone's asking them to do, their body doesn't celebrate. It goes, what in the world are you doing to me? And there's these metabolic adaptations that drive them to regain that weight. So they get frustrated and they yo-yo nonstop.
You said metabolic adaptations.
Correct.
Could you explain a little bit more about what that is?
So there are very complex interactions that are controlling hunger, satiety, all these things that control what we call an energy homeostasis, right? So your body is doing a very good job at protecting you at the weight set point you're at.
Yes.
So for some patients, again, with this health disease, when they start to lose weight, you're no longer in energy homeostasis. It goes, hold on a second, I was protecting you for feast or famine, for almost a hibernation mode. So there's 2 forms of metabolic adaptations that we know about. One is at some point, typically around week 40, you actually have a reduction in your metabolic rate. And you've been doing the in-bodies, right? Mm-hmm. So that basal metabolic rate. Your body actually will decrease your resting metabolic rate by 15%
yes.
After actively losing to drive you to regain. Right. So suddenly you're going along, you're doing all the things you've been doing successfully, and you start to regain.
Can I add to?
Yeah.
So in-body is, I've got actually on the science page, I talk about the in-body and analyzes your percent body fat, visceral fat. Maybe you could talk about the basal metabolic rate and the visceral fat connection, or at least the basal metabolic rate to people.
So basal metabolic rate I do take with a grain of salt, because most of us may not have access to the in-body. It's fantastic to have. There's some calculations you can do online, but it gives you a general idea of how many calories you burn within a 24-hour period, right? Mm-hmm. So you understand what you should be putting into your body. With that being said, one of the things that I always make sure that people are aware of is just looking at the amount you're putting in is like telling you put 10 gallons in your car. Mm-hmm. Well, if you have a diesel and you put gas in, you kind of screwed yourself. So you have to know your metabolic fingerprint. Do you have insulin resistance? Do you have type 2 diabetes? Do you have an autoimmune condition? Because knowing your metabolic rate is one piece, but understanding your metabolic fingerprint and how different food impacts you is another very, very important piece. So it's why these fad diets come around. It's why maybe something that worked for your friend worked for them, but not for you, right? Mm-hmm. So basal metabolic rate's one piece of the puzzle, but not the complete piece. But there's no doubt, if you think about it, if you reduce how many calories you're burning in a 24-hour period, with that metabolic adaptation, what's going to happen? You're going to regain. The other thing that happens, so there's another form of metabolic adaptation. You have all these complex hormones in the gut, the adipose, the pancreas, the brain, that controls that weight regulation, right? I think of it like a thermostat. And when you start to lose, suddenly your brain says, hold on a second, I don't like what's happening here. And it drives the hunger hormone, it decreases the satiety hormone, so you're suddenly hungry all the time and never satisfied. So I'm telling you, I need you to eat a little bit less, but your brain's saying, no, I need you to eat more.
Yeah, right.
So how do we, right?
I remember that, yeah.
So how do we do that? And that's where the science and the medical comes in. And for us in the obesity medicine world, we use pharmacotherapy or medications. And I always tell patients that how I practice medicine is I don't give you a Band-Aid. So if you have a hole in your plumbing, I'm not going to give you duct tape, I'm going to give you the plumber. So for those of us, or for those of patients who struggle with obesity, their brain and the gut aren't talking. And I need to help them get back to normal physiology. Right?
So
it's so much more complex than eat less, move more.
Yeah. Well, and what I've talked about with people as well is I emphasize how everybody's an individual, and that what works for me, it might work for you, but it might take you twice as long, half as long. Like Amy said, everybody's got internal physiology to deal with. So one of the things I tell people is you have a lawyer, you have an accountant, you have all these people around you that supposedly help you because you don't know as much about those things. But why don't people seek out somebody like you? Why do they try the fad diet first? Why don't they come to you? Why does it take so long for them to get to you?
Because
like
for
people
most
like me?
of their life, and they've been told that they need to eat less and move more and they'll be successful, right? And I always tell people the definition of insanity is doing the same thing over and over again and expecting a different result. So we are very much hoping that there's going to be a cultural shift with respect and understanding to those who are affected by this difficult disease state. There is a lot that I do outside of practice to help to move advocacy. So we currently are creating curriculum to develop into medical programs so we can teach other healthcare providers about this disease state. There's a great group out there called the Obesity Action Coalition that's helping to make sure that when obesity is discussed, it's discussed as a chronic disease state. So now we also have to realize, Nick, that I'm not stating that everyone who struggles with weight is affected by obesity, right? So there are some people who life just got away from them.
Yeah.
Right?
I think I'm one of them.
So I talk to people that you have to realize that there's multiple pieces of the puzzle when it comes to weight. 40 to 70% of your weight set point is genetic.
Wow.
So you
didn't know that.
Bless or curse your genes.
Well, yeah. So there is some truth to that when people say, "Oh, they must have great genes."
Exactly.
Oh, okay. All right.
Yep.
Well, I don't have those, so.
So everyone's unique, everyone's individualized. And so when I talk to my other healthcare providers and patients about this, the patients who I'm seeing, they are affected by obesity.
I see.
They are affected by this disconnection between this complex inner working of a weight set point and weight regulation. And they're doing everything in their power to try to get down there, but when they do, their body says, I'm driving you right back up. Others may just have life gotten away from them, but they don't have as complex of that genetic preset. So when they lose weight, their body goes, oh, thank goodness. Thanks for coming back down here. But if you have obesity, it's just another added layer.
And other thing I wanted to point out is, as I started the relationship with Amy, we started out, and then we had another meeting and another meeting. she was always finding other things that may be affecting me,
Yeah.
and putting me on another course to try this and that, and that's the coaching part. This is what I try to explain to people. You know, we get coached in a lot of things we try to get better at all the time, and to have a weight coach, why, if that's really important to you. I'm sorry, obesity, right? Obesity Medicine Specialist, not a nutritionist.
I think I've ingrained. I think I've driven that into
you have driven it. You have driven it into me. So, but anyway, it's really important to have that coaching. And she actually looks at everything that medically about me too, and she'll point some things out. She'll learn some other things, and she's almost like almost like watching over my wellness.
So it's fascinating, you guys, because I think what we're running into in medicine is everyone's getting sicker, right? With current allopathic conventional medicine, and my training, I'm a PA, so physician assistant. So I went through a medical-based training. Mm-hmm. And it's absolutely fascinating, but I think one of the things I'm running into as I've been practicing longer is we really need to look at the patient holistically as a whole. So many times we treat one chronic health condition, such as type 2 diabetes, with medications that are weight positive. And then we suddenly make another chronic health condition worse. So whenever you address a patient, especially from the obesity medicine world, we want to know everything that's going on medically. We want to know if there's potential underlying disease states that have not been addressed and diagnosed, such as sleep apnea, which affects hunger hormones. And then we want to make sure that when we are creating a medical care plan, medication management, that we're using the med that's going to best impact everything that you are affected by. Because if you get this disease state controlled but make these 3 others worse, then we're just chasing our tails, which sometimes you have to do. There's no perfect world out there. But the discussion we have is, it's no longer really okay simply to manage our patients. We have to optimally manage them. And by doing that, you look at them as a whole and all the moving parts.
Yeah, so I just feel, I feel comforted that there's another individual out there that's looking at my overall well-being versus the dentist, the eye doctor, the specialist. So we've been here with Amy Ingersoll. She's the one that started helping me 17 months ago. I'm still with her, and she's coached me through quite a journey. Yeah. She's an obesity medicine specialist, and I think if you could just summarize kind of like where, if somebody came in the door and what you would tell them, that would be great.
Yeah. So one of the things you have to realize is obesity is a chronic health condition, and this age-old thought that is simply eat less to move more for patients who struggle with this disease state isn't sufficient anymore, and there's a reason it's not working. You have to respect the role genetics play. You can bless or curse, right? And you have to realize that for this disease state, it's the combination of the medical with the lifestyle that really makes the magic happen. And one of the reasons Nick continues to see me is this is a chronic, progressive, relapsing health condition. So I wish I could say that once you start the journey, that there's an end. But the difficulty is your brain and the body, if you have this disease state, it's always going to be trying to drive you back up to where you were. It's why the typical age-old, let's eat less, move more, isn't sufficient with it. So there's science, like you said, there's science behind it.
Science. You finally got that.
You got to know the science.
So we can't thank you enough. I think this is going to help a lot of people understand a different aspect.
Yeah.
And the worst thing for everybody out there, and I'm not a young man anymore, when you get older and the weight's been piling on and you try all these things that don't work, you start to believe that that's just your fate. That's, I got older, that's what I'm supposed to be like. And it's just not true. You don't have to be this way. So, my advice is to seek out a coach like Amy and see if you can make a positive change in your life. I did for me, so I can't thank you enough.
Yeah, definitely. I'm proud of you. Awesome. You put the work in.
So you did the great coaching though, so thank you very much.
And we do, so we just founded a local, hopefully soon to be a nonprofit called Arizona Obesity Organization. So, because one of the things is you have to find someone who does evidence-based obesity medicine. So if you're in Arizona, the Arizona Obesity Organization will have all the obesity medicine specialists within the state of Arizona who practice true evidence-based medicine for this disease state, which is a great resource.
I'll put that link on my website.
Yeah.
Nick Losole Young Again is the website, and I will have all this information there as well. Thank you again.
Thanks, you guys.